thank you, Mr. Chairman, for holding this important hearing, and welcome to all the witnesses. We can't wait to start asking you questions. The late Hugh Reinhardt, he was a prestigious health economist who often appeared before this subcommittee, famously said, quote, "It's the prices, stupid," when critiquing why the U.S. spends so much on health care. 20 years since Dr. Reinhardt's seminal analysis, our nation's inflated healthcare prices are still the primary reason why the U.S. spends significantly more on healthcare than any other country in the world. A quick comparison to other large, wealthy nations shows the U.S. is an outlier. We spend 2 to 3 times more on prescription drugs and medical devices. We spend $10,000 more on average per hospital discharge. We spend 7 times more per capita on health insurance administrative costs. Despite spending nearly 18% of GDP on health care, we have fewer practicing doctors and nurses, fewer hospital beds per capita, and a lower life expectancy than other wealthy nations. We also have the highest avoidable death rates and maternal and infant mortality, and an obesity rate nearly 2 times more than the average of our peer nations. None of these points are bragging rights, for sure. In other words, we spend more, but we get much less. So that's why I'm pleased that we're holding this important hearing on healthcare transparency today. I'm fully supportive of the efforts to shine a light on the fraud and the waste and the abuse percolating in our healthcare industry. But we need to do more than shine a light. Fortunately, over the past 2 years, we've made some major strides. First, we finally gave Medicare the ability to directly negotiate prescription drug prices, which will save taxpayers more than $300 billion over 10 years. The Biden administration has implemented price transparency regulations which require hospitals to publicly post prices for all their services on their websites in a user-friendly format. Now, the hospitals, I would say, have been slow to comply. But CMS recently found that at least 70% of hospitals are in compliance with the rules over 2 years after they were finalized. But this has to be 100% participation. CMS is now stepping up enforcement measures against the 30% of hospitals who remain non-compliant. And I would just put out a call today. Don't fall into the CMS enforcement lane. Do it yourselves. You've had time. Do this. Third, we're finally wrangling the abuses by Medicare Advantage programs. The administration has taken steps to recover improper payments to private plans and return this money to the Medicare Trust Fund. This is going to put money back into the pockets of American taxpayers and protect the long-term solvency of Medicare for future generations. Looking forward, we have to examine reforms to pharmacy benefit managers, PBMs, the secretive middlemen in the prescription drug industry that drive up prices and keep out affordable drugs. And Mr. Chairman, I was glad to hear in your opening statement that you view this the same way. Absolutely. Count me in with you to do something about this. We really have to start spending smart. This means spending money on preventive care, public health, and biosecurity. So again, I'm glad that we're having this hearing today, but I'm disappointed that we didn't receive the witness testimony until 1 o'clock yesterday, even though the hearing was noticed 3 weeks ago. But let's have a good hearing. I want to acknowledge, and I saw them out in the hall, the patient rights advocates. They all have patient gowns on. I don't see them in the hearing room. I guess they'll come in shortly. But I want to acknowledge their advocacy, because advocacy is always highly instructive to Congress. So with that, Mr. Chairman, I yield back.